Hi everyone, it's Caroline Lambert presenting to you my health information technology idea for McNairy County, Tennessee. Like many places, McNairy County has a problem with heart disease. Why is this such a problem? The rate of heart disease in the county is much higher than the national average. According to Community Commons, 9.2% of adults have been diagnosed with heart disease in the county. This is compared with the national average rate of only 4.4% of adults being diagnosed with heart disease. This is almost a 5% higher rate for heart disease in the county as compared with the national average. With a high frequency of heart disease comes with it a higher mortality rate from heart disease. Mortality rates for heart disease are 296.3 per 100,000 people for McNairy County. This is compared with the national average mortality rate in the United States as 171.8 per 100,000 people. This is an increase of exactly 124.5 more people per 100,000. Clearly, this is a significantly higher rate. What led us to these markedly high numbers of heart disease, you may ask? As nurses, most of us know the risk factors for heart disease development, but it's hard to remember everything we learned in nursing school. So, in case you forgot, the top 5 risk factors of heart disease are tobacco use, alcohol use, hypertension, hyperlipidemia, and obesity. Some contributing factors to McNairy County's spike in heart disease are about 54.09% of adults have smoked over 100 cigarettes in the county. 29.44% of current smokers in the county attempted to quit in the last year. 32.5% were diagnosed with hypertension. 49.4% were diagnosed with hyperlipidemia. 39.2% of those above 20 years and above were considered obese. And 33.6% of those that are 20 or above said that they got no physical activity in their leisurely time. This is compared with 60.02% of smokers in the U.S. that tried to quit last year. 28.16% were diagnosed with hypertension. 38.52% were diagnosed with hyperlipidemia. 27.5% of adults 20 or above were diagnosed or were considered to be obese, and 21.8% deemed themselves not participating in any physical activity. Again, you can see that McNairy County has higher rates for all of those as compared with the national average. With statistics like these, it's easy to see why there are more people dying of heart disease on average in our county than the U.S. There's more. 100% of the county is deemed to be a health professional shortage area. In the county, there are only 34.26 primary care physicians per 100,000 residents. This is a significantly higher or lower rate as compared with our national average of 87.8 per 100,000. So why is this so significant? Without available primary care physicians, chances of heart disease of being undiagnosed, undertreated, are more likely. With this shortage also comes the added burden of traveling just to go in for a routine office visit and money to get to those appointments. So what can we do to fix it? With technology increasing every day in our communities, it's only logical that it should be utilized to benefit people's health. 83.8% of households in the U.S. stated that they owned computers. Of those households, 73.4% of those aged 15 and above said that they had access to high-speed internet. Of 2,252 adults surveyed, 91% of those were reported to have cell phones. So why is this information important? With many more people having access to internet and cell phones than not, we could say some, if not most, have at least some health factors that put them at risk for developing heart disease. Edwards et al. 2013 found in their study that by sending encouraging text messages to quit smoking, more than twice the amount of those had quit as compared to the amount that had quit when traditional means such as leaflets were used as the main mean of encouraging smoking cessation. Clark et al. 2014 also found that heart failure patients aged 70 and above also benefited from telemonitoring by seeing a reduction in mortality and heart failure related hospitalizations. If we can initiate a county-wide program to reach out to those with computers and cell phones, we could begin to take steps in decreasing heart disease in McNairy County. So how will we do it? With surveys sent to households in the county, we can assess the number of those with health risk factors, cell phones, and internet access by tablets, computers, or other forms of technology. After the survey is performed, those that meet the criteria of having at least one health risk factor and at least one form of technology access, we can begin integrating telehealth into homes. The integration of various telehealth modalities will be accessed through one program that will be downloaded onto people's devices. It's vital to meet with and discuss compliance of primary care physicians who will participate in telehealth services. Local cardiologists and primary care physicians will be contacted in the surrounding areas of Corinth, Mississippi and Jackson, Tennessee. It will also be necessary to discuss grant money to pay for the estimated $7,000 to initiate telehealth. Not only will grants help with costs, but the possibility of physicians and cardiologists being able to bill people's insurance companies can also be beneficial. So what are the estimated costs of the program? Like I said, ultimately $7,000. Broken down for the survey development and distribution, we estimate to be about $1,000. Equipment for high-risk users would be about $4,000. Program development will be what we estimate is $2,000. So what will this program include? The program will feature the ability for the patient or user to enter vital signs that the physician will be able to view, the ability for a patient and physicians both to enter and send reminders for appointments, medication refills, and when to take medications. Text messaging services to encourage people to quit smoking, make healthy food choices, and get some physical activity will also be implemented in this program. Alerts will also be sent to doctors when abnormal vital signs or EKG rhythms are sent through and recorded through the program. So how long do you have to wait? It's estimated to take a month to develop a plan and expected timeline for the anticipated release of the telehealth program into February 2018. We will first begin applying for grant money with the local and state governments. It's expected that these correspondences will take the longest and will be anticipated to take the 11 to 12 months prior to the release of the program. To allow for enough time, it's estimated that the survey period to develop, send, receive, and group these residents will take about 3 months. We will then present the survey results and discuss telehealth needs with local physicians about partaking in telehealth. This process is estimated to take about 3 months to meet with the appropriate number of providers as well. After we have surveyed groups and physicians aligned after the first 6 months, then the development of the program will begin. The development will take an estimated 4 months, in which the remaining 1 to 2 months prior to release will be spent planning and announcing and releasing the program. So how will people benefit in the county from this program being implemented? Healthy People 2020 objectives for heart disease can be met by decreasing heart disease deaths and reduce risk factors. This program can also reduce tobacco use and increase physical activity, which is also listed on Healthy People 2020. The triple aim for health care can be met through this program as well. Sewell 2016 states that telehealth reduces expenditure, provides more accessible health care, and provides better quality care. Costs are reduced by patients not having to pay co-pays at office visits and to pay for staff involved in the care for those patients during their visit. The program will increase satisfaction of having access to physicians at home and will improve the health for the county as well. In conclusion, the implementation of this program, we hope to increase the health of people in our area and reduce the diagnosis and mortality rate of heart disease. Our goal is to reach at least 80% of those eligible according to our survey standards 1 year after implementation. We also hope to see an increase in available primary care physicians that provide their services to those using telehealth services. If telehealth succeeds in decreasing health risk factors in heart disease diagnoses and deaths in the county, it is possible for the program to expand to other targeted people in the county, such as those with diabetes as well. That is it for my presentation. I hope you all enjoyed.